Well, April is Oral Cancer Awareness Month, and here in Nigeria, plans are afoot to hold a 5-kilometer oral cancer awareness walk. For details about the Nigerian leg of the commemoration, what the entire concept means, where the walk will be taking place, and how to facilitate access to quality and, of course, affordable healthcare services and deliver that and promote basic orientation on healthy living to indigent communities all across Africa. We're now being joined by Dr. Uku Ntekim, who is a member and board of trustees of Beaconhill Smile Foundation. Good afternoon, Doctor. Thank you for joining us today on News.
Thank you for having me. Thank you.
All right, could you tell us a little bit more about Oral Cancer Awareness Month and, of course, this proposed walk that will be happening very soon?
Thank you. The Oral Cancer Awareness Walk is just to bring to the public, to make them aware that oral cancer is real. It's here to stay, so to speak. It's a reality which we used to deal with, and the incidence is on the increase. So the idea of the walk is just to sensitize the public on the realities of oral cancer.
Okay, so when is this walk taking place, and we're in Lagos? Which routes are we talking about? Just give us more idea of what this walk entails.
Okay, so the walk will take place within Victoria Island. We've not really picked a date. No, we picked a date. It's on the 27th of April this month. The route hasn't been confirmed yet, but it's within Victoria Island, and it's 5 kilometers. It will begin somewhere in one of our branches, and it will also end within Victoria Island. It's just 5 kilometers. And we are hoping that we want to have at the minimum 100 participants for the walk.
And it's such a good initiative as well for spreading awareness. For those who aren't well versed in oral cancer, because we know breast cancer.
Yes.
Not to say that we know them like that, but they're the more popular or prevalent ones.
Yes.
Oral cancer seems to be a little bit more less talked about. So how does it manifest? What are the symptoms? Could you just give us a little bit more awareness and maybe the percentage of individuals that are living with such in Nigeria? Okay,
so the prevalence right now is at least 1.5% of the population within the country. And it's interesting you ask the question, because that's the reason why we're doing the sensitization. It's really real. Oral cancer is a cancer that like any cancer that can affect any part of the body, but this occurs within the mouth. Sometimes it can spread to the head and the neck. So typically, if you notice, that's for anyone concerned, it typically manifests as a sore within the mouth, or a wound, or an ulcer. And so this is not to scare anybody, because once one may think that once there was an ulcer in the mouth, I have a cancer. No, it's not like that. But typically, any sore or wound in the mouth takes within days or a few weeks to heal.
Right.
But once you have a sore that just refuses to heal, and also it begins to increase in size, and you experience some other things like pain and swelling, then you need to see a doctor quickly. It's really important.
And just to clarify, you're not talking about like gum issues. You're talking about actual
an
mouth,
actual wound or sore, or swelling
Okay.
in the mouth. So just to add to what I'm saying, early detection is key.
Okay.
Yeah.
Okay, so I'm wondering, how affordable is it to treat oral cancer in Nigeria, and is it even possible to prevent it?
Oh yes, very, very possible, because if you see your dentist regularly every 6 months or 3 to 6 months, and it's detected early, it can easily be cured. Well, in a manner of saying, yes, it can be cured easily. In terms of affordability, it's quite affordable, because it's not a treatment that will really dent your pocket so much. But the key to preventing and curing it is early detection.
Well, sorry, but for when it comes to cancer, we usually hear of chemotherapy, and
Yes.
of course we know how expensive that can be, and even the impact that it has on the human body.
True.
So do we also go that route, with oral cancer as well?
So yes, if it gets to a point where it goes beyond, like I'll say in medical terms, stage 2 to stage 3, or the final stage, then they are talking of chemotherapy, radiotherapy, and other medications to just manage the condition.
And speaking of early detection, we know our healthcare system in the country is not where it should be, and especially in the rural or indigent areas where these things might manifest and there isn't quite a lot of information that's available. So what is it that the country or the government can do to better give access to those communities who do need to be able to prevent some of these diseases before they become worse?
So to answer that question, right, the government needs to invest more in primary health care. And if they do that, make it affordable for even indigent citizens to see a practitioner as soon as possible. So if it's detected early, then they can be transferred to a bigger facility for it to be tackled on time, basically.
Okay, so we usually hear, about living healthy lifestyle, as prevention for most of those crimes. Could you tell us a bit more about that?
Well, in a manner of saying, healthy living involves eating right, eating well, eating and drinking the right things, not eating and not drinking the right things, and also exercise, especially if you are within your middle age and getting towards old age, really important. So what you eat and what you don't eat, what you drink and don't drink is really important especially for adults as we grow older. I will say that once you get to middle age, like I am, you need to invest time to exercise and eat right. Really, really intentional about that.
How easy is it to eat right?
It's not easy.
When you consider
I can tell you for free. It's not really easy. At least I can speak for myself. In the last 4 to 5 months, I've lost close to 10 kg because I was really overweight. So, and I had so many issues, but it goes for all of us. It's really important to take care of yourself. What you eat is so important. What you drink is so important. What you don't eat and don't drink is also very, very important.
And maybe just some helpful tips. What are the statistics of oral cancer? Is it seen more in women or in men who smoke, or in older individuals, in children? Maybe if you have a lot of dental issues, that's a
very interesting question. Sorry to cut you
and
short.
also gastro issues. Does that affect? Because we know that also affects a lot of the things that happen in the mouth. What are the correlations there?
So to answer the first question, right, oral cancer, according to statistics, it occurs more in men than in women, and it can occur anywhere within the oral cavity, the throat, the cheeks, the tongue, the throat, anywhere. And obviously, for one who, for example, for a smoker, the statistics also say that anyone who smokes is also the propensity to get oral cancer is higher. And not just smoking, it can affect other parts of the body as well, not just the mouth. And also betel chewing, which is not too common in this part of the world, but in some parts of, I think, Asia, there's particularly not the chew that can predispose someone to cancer. So things like that, yeah.
So is there a vaccine, to prevent oral cancer? I'm reading something about the HPV being responsible. How true is that? So
the HPV, the human papillomavirus, I don't know if there's any correlation, but it's possible, right? So I'm not entirely sure if there's any vaccine to cure cancer. To prevent cancer, sorry. But there is a vaccine to prevent the development of the HPV virus, yes.
But is it the HPV virus that is responsible, mainly for oral cancer, or do we have, other viruses that can cause oral cancer?
Well, there is no known cause for cancer as it were, but they are just predisposing factors. So the HPV virus is one of those predisposing factors to oral cancer.
I would assume, since women are the ones that are least affected, that maybe the correlation isn't quite as strong, but I'm no doctor. I'm just throwing that out there.
Statistics will tell you one thing, but the reality is another thing, right? Yeah, so that's the way I'll just explain that.
And does it affect a lot of Nigerians? Do you see a lot of cases, and where do you see those cases? Is it in the cities, or is it in the rural environments? What are the
Sadly, we see a lot of cases. Okay. In fact, the incidence and the incidence is on the rise. And we see them more in the urban centers. And that goes without saying. Certain habits predisposes one to this condition more than the other.
Can you talk about the habits, please? Sorry to interrupt.
Okay, good question. Smoking. Smoking, I'll also mention chewing certain things, certain nuts, and not just smoking, not just tobacco, all kinds of things that people smoke, And there's this thing they do in the club now, vaping and things like that. All this is actually predisposed to oral cancer. There may also be a genetic link to it, just like there's a genetic link to for breast cancer. So just to mention just a few.
I mean, we can continue grilling you about this, but I know you have lots of things to do and also to prepare for the walk. Could you just give us one more time, the date of the walk?
So the day of the walk is the 27th of April, 2024. We'll start by 7 a.m. It's a 5-kilometer walk within Victoria Island. And then for those who would love to register, can I say that?
ahead,
Yeah.
please.
So they can, if they go to our Instagram page, Beaconhill Foundation, they can register on our bio. The link is on our bio to register on the walk. You can also visit our website, beaconhillsmilefoundation.org.
Such important information. Dr. Uku Ntekim, thank you so much for joining us this afternoon here on
Thank you for
Newsday,
having
and
me.
all the best
Thank you
with the
very
walk.
much. Thanks for having me.